Good afternoon, everyone. Thanks for this wonderful opportunity to present about our solution at the hackathon. I think we approach the problem very differently. Ours is a 3-year-old startup. We are already live with some of these solutions in some of the hospitals. When we looked at the problem, we typically saw that hospitals have very fragmented systems. I think panelists also spoke about it. Secondly, I think most of the hospitals want to get into the AI journey, right? So they are trying to use LLMs, and we know that LLMs have a cost problem. They also have a compliance problem with the data moving out of the hospital systems. I think this is a real problem that every hospital will face. So what we said is 2 years ago that medical SLM for India is the need of the hour. When I say medical SLM, there are multiple components in it. So you need to have a small language model very intelligently defining the clinical aspects, right? So which is missing in India. So we started working with Meenakshi ji with NHA and trying to understand the FHIR formats, the standard formats, and the underlying layer beneath this SLM is actually the FHIR database layer. So we started implementing those solutions in a couple of hospitals. What I want to bring up is 3 things. Number one is, obviously, we have built, we are around 60% in our journey to build a medical SLM. Second, very important is the classification. We worked with NRCS formats. And once you upload any document, we worked on a discharge summary to claims as a workflow. So we understand today in discharge process, 80% of the documentation is manually written. Yes, every hospital claims the digital journey, but if you go and really look at it, it is handwritten clinical notes from the doctor and the nurses. So what we created a platform is to just upload the document, and automatically you will get a case summary and a discharge summary document generated. And from there, we enhance that to get the auto coding using again these standards defined by NHA, using the SNOMED formats. We are able to get to the auto coding, and from that auto coding, we are able to get to the claims processing. So there are 2 things to remember. The medical SLM is one aspect, but the triangulation piece on top of it, where clinical context has to be saved. It is not just generating a FHIR bundle or generating a document, but clinical context has to be retained, and that we have built our own models on top of the SLMs to make sure that the hallucinations are removed. Then really getting to actionable items, like we're saying that what is the symptom, what is the medication, what is the vital, that kind of clear-cut context should be provided by the clinical side. So that's where our models are built on top. Then the real aspect or innovation comes also in the last piece of the puzzle, which is the semantic intelligence and interoperability. So there is always keywords that are punched in, right? Like for example, SOB, shortness of breath. That can lead to multiple codes in the SNOMED. So really trying to understand what exactly is the context to put the right SNOMED code is what we have developed over the last 2 years. And we have used a lot of integrations and data from CDAC. We worked quite closely with Ashut Patel ji, and really understanding how exactly to implement that. And that's how we ended up creating the FHIR R4 generation. So this hackathon was a natural transition for us, where we could use our platform to really build a solution. And we really thank the CDAC team and NHA team for working with us for the last 2 years in making sure this journey has been very fruitful. We are live in 3 hospitals, and we are taking this platform and solution in a long way. So what we want to build as a company is a medical SLM, which is first of its kind. Medical SLM, it is not only providing a standard-based, low-cost solution, which is very useful for the hospitals, but very, very underlying layer of interoperability. I think that's what we've focused. And my team is here, and I really thank the team for working relentlessly for the last 2 years. Thank you.